Welcome to week 4 class. This week marks the midpoint in this course, and we've covered a lot of ground in a very rapid manner. Building on the knowledge that we've all gained from week 3, we continue on with the specifics of the patient record. In our closing slide, we will recap weeks 1 through 4 briefly, as this week concludes with our midterm. Regardless of the record delivery mechanism, i.e. paper or electronic, a face sheet is generated in a similar manner. This document contains clinical and administrative data. It's presented to patients to summarize their visit and list out actionable items in an easily understood manner. The demographic data consists of the patient's name, as well as other details like address, gender, etc. Financial data will include insurance information for this patient. Clinical data will include the patient's diagnosis, among other details. Page 134 and 135 in your course text provide excellent examples of this type of document. Page 137 will list out the specific components in each category. There are several other forms that make up a patient record, and we'll explore a few of them right now. Advance directives are legal documents provided by patients that list out their individual wishes should they become ill, and there are no foreseeable pathways for successful treatment. Informed consent is the process by which patients will consent to something knowing that there might be various consequences related to the action in question. In healthcare, think of it like accepting a care pathway with the knowledge that adverse outcomes are also a very real possibility. Patient property forms list those items that a patient brings with them to the hospital. Pretty simple. A certificate of birth is a legal document that is provided for a newborn. It lists several different details, such as parent demographic information. A certificate of death is literally the exact opposite of what we just listed in the previous bullet. It is a document issued regarding the death of an individual. It will include your typical demographic information as well as your cause of death. Here's a sample of an advance directive for a patient. In this case, the patient does not wish to be revived in the event of a cardiac or respiratory event. If this were to occur, the patient wishes to be allowed to pass on rather than receive treatment. These next two slides will list out what would make up clinical data in an inpatient record. The outpatient record consists of several different components that differ somewhat from inpatient as listed below. Remember, outpatient encounters are those visits that are not admissions. The physician office record is a bit more thorough, and it mirrors the other two types only somewhat. The main differentiator here is that there is a superbill or encounter form that allows the professional to tick off what services have been done for this patient during the visit. Remember, this is the type of record that will be added to frequently because we tend to visit these healthcare venues much more often than the others. Literally, all of the forms found within a record are created with careful consideration regarding purpose and importance. Organizations typically have committees made up of professionals from patient care areas that have a sole purpose and responsibility of reviewing these forms to ensure that they meet needs and requirements per venue. The Form Committee looks at how documents are used to facilitate efficiencies in the collection of patient data. They attempt to streamline approval processes when new forms or revisions are needed. This committee also ensures that documentation is compliant locally, statewide, and federally. Lastly, they are charged with ensuring that each document is adding to the overall quality of the clinical record. Now, let's recap weeks 1 through 4. During your introductory week, we explored the history of medicine and the delivery of healthcare in the United States. We then covered the differing themes of accrediting and regulatory agencies. In week 2, we explored the various types of careers found within health information management. We then reviewed the various HIM professional associations that HIM professionals can affiliate themselves with. We then closed week 2 with a review of the various types of managed care models and what long-term care looks like in the United States. In week 3, we explored the patient record and the responsibilities of providers and patients. We also discussed the differences between administrative and clinical data, the process of correcting inaccurate documentation, and lastly, storage methods. This week, we looked at patient records in more detail and covered specific forms like advance directives. This has been a busy 4 weeks, and now we shift our attention towards the midterm. In week 5, we will take a look at the regulatory landscape as well as some of the storage and filing and numbering systems that are used today.